Hello, everyone. Good morning, good afternoon, good evening, depending wherever you are. It's my pleasure to introduce our guest speaker for today to this GLOMCOM seminar at Educational Partnership between ISN and GLOMCON. And let me introduce our guest speaker for today, Professor Joris Roelofs.
Thank you very much, Carmen, for this very kind introduction. I'll just try to share my screen. May take 1 minute. That works, right?
Yes, perfect. We are
Thank
seeing
you
your
very
screen.
much. Thank you.
Thank you.
Yeah, it's indeed a pleasure to join this this well-known seminar series today. The GLOMCON seminar series. And I thought maybe it's a nice idea if I would share some research data from our studies into the role of platelets in acute and chronic kidney injury. So it's a bit more fundamental and translational research that I will bring to you today. Obviously, I'm quite sure that the GLOMCON public that we have today in the seminar online is well aware of this, namely the fact that kidney disease are a really big global health problem. So approximately 850 million persons worldwide have some form of chronic or acute kidney injury. So that's well, roughly 1 in 10 people. I'm quite sure you are well aware of that. And now you may say, so what about platelets? What's so interesting about platelets? Well, first of all, we know that both acute kidney injury and chronic kidney injury, irrespective of the cause of renal function decline, are usually accompanied by dysregulation of coagulation and hemostasis. And we know that people with both acute and chronic kidney injury have hyperactive platelets. That's an old observation. Now, what about platelets? Blood platelets are the smallest cells in our circulation with a diameter of 2 micrometers, which is approximately 1/5 of the, let's say, the average cell in the human body. So they are really very small. And they are this small because they do not have a nucleus. So they can be very small. They lose the nucleus when they are produced by the megakaryocyte in the bone marrow. But they make up for their very small size by circulating in huge numbers. So on average, 150 to 450 billion platelets per liter are present in our circulation, and that's really an amazing number. So they may be small, but due to their large numbers, they may have some quite profound effects. And yeah, we have known for many years now, in fact, this was already discovered at the end of the 19th century, that platelets are crucially involved in hemostasis. If you have low platelet numbers, you have a bleeding tendency. That's an old observation. And here we see the difference between resting platelets, so small biconcave, really platelets, so flat shaped cells. And when they become activated, such as during hemostasis, but also in patients with dysregulation of homeostasis and acute and chronic kidney disease, they undergo a shape change and they look a bit more like, let's say, octopuses with micropodia that and a more round shape. Now, apart from being active in hemostasis, we now know that active platelets can contribute to a lot of different pathophysiologies. So upon activation, the platelets can produce all kinds of adhesion molecules, growth factors, cytokines,